Non-governmental organizations are increasingly being used as vehicles for development. They are becoming a measure of citizens' participation. They work on issues of poverty, illiteracy, health, population, and women empowerment. Many of them focus on peculiar issues of different regions or parts of the country. For what non-governmental organizations have been doing to improve the lot of the downtrodden as well as the structures for macro-social development among Nigeria's local communities, we are now being joined by KAYODE Oshinuga, an insurance practitioner and district governor, District 404B2, Nigeria. Welcome to the program.
Thank you for having me.
Okay, let's start with your initial assessment of what the NGOs in Nigeria and how they're currently helping in community development.
Well, thank you very much for having me, and good afternoon, viewers. Well, you know, there are various types of NGOs with various different callings. Some are into human rights activism, some are into community development, and some are like we, the Lions Club, we are into community development and serving the underprivileged. So in that role, in that respect, our roles are defined by what we set out to do. We are not into activism or anything, right? Government activism or human rights activism, but we're into community development, serving the underprivileged, making sure our communities are better than we met them. So the roles of each of the NGO is defined by what they set out to do in each of the communities.
But we've had reports of some NGOs, enabling corruption and money laundering in conjunction with some, government officials. What do you say to this? And if true, how can it be tackled?
Well, it has been said, but I don't think that it has ever been proven. Right, so many NGOs, I mean, so many people have said so many things about so many NGOs engaging in corruption, money laundering, and taking money from probably foreign partners, but it hasn't been proven. Right, so as far as it still remains in the realm of speculation and allocation, there's very little we could say about that. But as far as we are concerned, we are Lions. We are represented in over 200 countries of the world, with over 1.4 million members across the world. We've been engaged since 1907 in humanitarian services, community development, and betterment of our various communities.
And speaking of communities and humanitarian services, the community has been going through quite a lot in the last 2 years, COVID-19 most especially, and also the issue of insecurity that affects the food chain supply. A lot of things affect the chain. I'm wondering how NGOs have been able to cope with this, or if you have any advice for any NGOs that are struggling to help communities because of these new issues that are within the community, and if it's something that your NGOs have struggled with.
Yes, we have actually struggled with it. We have actually worked along that line, even before the coming of COVID. For instance, Lions Clubs International has five focal areas, which include fighting diabetes, vision, that is preventable blindness, and helping those we could help in respect of their regaining their sight. We're also into environmental advocacies. We are also into fighting childhood cancer, and importantly, fighting hunger. So we have always been there even before COVID. And when COVID came, it met us in our familiar terrain. We had to mobilize our members across all the world. Well, unfortunately, this happened to every part of the world. So everybody is now to your tent, oh Israel. But as far as Lions is concerned, we still got a lot of support from our colleagues all over the world and in our international organization. And at the breakout of COVID in Nigeria, we were there, we stood with NCDC, we stood with the Federal Ministry of Health, we stood with the Lagos State government through cash donations, through donations of materials to NCDC, both in Lagos and in Abuja, the federal headquarters and to Lagos State government. And so it has always been there. Then in respect to hunger, which ravaged extensively during the lockdown and periods immediately after the lockdown, and it's still there because we have been in this terrain before. We have always been doing it. It wasn't really difficult, though we had challenges because of restrictions. Then you cannot move from one area to the other, from one point to the other. But we got the cooperation of the authorities. We were able to move. We were able to give out the palliatives in our own ways to members of our various communities. You know, in this country now we have about 900 Lions clubs spread across the country with various areas of concentration, and each of the Lions club was able to take care of our immediate community.
All right. Can you talk us through some of the projects that some of these NGOs engage in, specific examples, you know, like what the project was and how it has benefited ever since it was completed, the community? Okay,
I will start that. I will talk for Lions Clubs International, of which I am the district governor for B2. And not very far away from you at Lekki Phase 1 there, you see the Lagos State Motherless Babies Home. Right, that is a project of the Lions family in Nigeria, and it has always been there. We are still on the board of management of that home, so providing shelter, providing succor to abandoned babies. We have had so many interventions in the health sector. For instance, if you go, last October, we commissioned the 32-bed dialysis center, which has been adjudged the biggest and the most equipped in West Africa at Lut. Right. That was a project of the Lions Clubs in Nigeria, together with our international office. We have had intervention in the area of cancer. If you go to Lasut, we have the cancer center, a mighty building, which is providing succor to people who are suffering from cancer, in addition to the diabetes clinic there at Ogun State there, at Ota State Hospital. We have a modern eye center there. In fact, the last World Sight Day we had, we screened over 2,000 people, and about 500 underwent surgery at that facility at Ota. Last month, we commissioned a ultra-modern eye center at Oshinuga in Osun State. It was commissioned by the state government. That cost the Lions of the world, of the entire world, $500,000. So, and so many other ones. We have diabetes clinic spread across here and there and everything. It
sounds like some very positive things that you're doing for the community, and we definitely do appreciate that. But many thanks for coming on the program. KAYODE Oshinuga, who is District Governor of the 404B2 Nigeria. Thank you very much for coming.
Thank you for having me.